And I'm Lorenzo Hall. So as millions feel the impact, here are three things you need to know right now. First up, the Senate is just stuck. For the sixth time, lawmakers failed to pass a bill to reopen the government. The GOP-backed plan fell short, while Democrats insist any deal must include permanent health care tax credits. Second, jobs could be gone for good. President Trump warned that if the shutdown drags on, some federal positions could be cut permanently. Agencies are now reviewing which jobs might never return.
And the third thing to know, the IRS is going dark after operating 5 days on special funds. The IRS is now furloughing nearly half of its staff and closing most operations. That means taxpayer call centers, audits, collections, all of that is on hold for now. The Senate has failed to advance the funding bills to end the government shutdown for the sixth time today. The vote again along party lines, 47 to 52, with 60 votes needed to move forward.
Yeah, so the stalemate between Democrats and Republicans centers around health care funding, as we mentioned, but there is one Republican lawmaker who is breaking with her party.
Kelly Vaughn is live at the Capitol with the latest. Kelly, tell us more.
Well, you know, Democrats, of course, are refusing to endorse this temporary spending bill because it allows those Affordable Care Act subsidies to expire. This is something that it could increase the health care premium rates for millions of Americans. And now Republican Representative Marjorie Taylor Greene, she says she's splitting with her party on this issue because she says if those subsidies expire, rates could double in 2026. There are 24 million people who use the health insurance marketplace, Affordable Care Act, to use their health insurance, and more than 20 million of those people use subsidies to help them afford coverage. Economists with the Center for American Progress found that if those subsidies aren't extended, average premium costs would more than double nationally. They crunched the numbers here locally and found that in D.C., premium coverage would increase 57%. That raises average premiums more than $1,000. In Maryland, premium costs would increase 154%, and in Virginia, they'd increase 167%.
There's one plan in Maryland that I saw that would go from about $600 per month to about $1,700 per month because of the expiration of the subsidies.
That's Emily Yee. She's an economist and healthcare expert, and she says that the premium increases could lead to some people choosing to go without health insurance, especially if there's someone who anticipates being healthy next year. And she says if more people do choose to just go without insurance, if these premiums do rise, there are ripple effects that could impact all of us. One of those being it could impact healthcare providers and would put a strain on them, because if those clinics and hospitals are forced to give more uncompensated care, that would strain them and it could force them to close. And if that happens, that would make it harder for everyone to get health care.
All right, we'll continue to monitor this as the stalemate drags on. Kelly, thank you.
Maryland leaders are doubling down on their support for federal workers as the government shutdown stretches into its second week.
Yeah, in a joint press conference at BWI this morning, Governor Wes Moore and members of the state's congressional delegation, they called for Congress to act quickly, and they also reassured workers that help is available.
This assault on our federal workers is ongoing from the President of the United States. So I'm thankful that we have a federal delegation that's standing firm and saying a prerequisite for keeping the federal government open should not be raising premiums by 70%.
The moral center of our country is being decimated right now. It is immoral, cruel, and inhumane.
Now, the state is offering no-interest loans to essential employees working without pay right now and coordinating with private partners to prevent evictions, utility shutoffs, and disruptions to services like SNAP and Medicaid.
Meanwhile, the Metropolitan Washington Airports Authority says at Reagan National and Dulles airports will continue as normal. Apparently, airport services like parking, concessions, and public safety are not tied to the federal budget, and the essential federal functions like security screening and air traffic control remain in place. Our coverage of the government shutdown continues, streaming right here on WUSA 9+. Scan this QR code for a direct link or text the word shutdown to the number on your screen.
Yeah, and that's 202-895-5599. That's also where you can send us any questions you might have. We'll get you answers and share them right here on WUSA 9.